Hello everyone! Thank you for choosing this presentation to listen to, and I appreciate your time. My name is Emily LaRoche, and I am currently pursuing a career in child life. So naturally, when it came time to create a policy brief for my Capstone 2 project, I wanted to really show how this field is so important and has the potential to make an impact on everyone, not just a child. My amazing group members and I decided to inform the Board of Directors from the Hospice of Spokane on the benefits of educating families during their end-of-life care. For credit purposes, this presentation was a collaborative effort from Kylie Hurd, Candace Kelp, Catherine Young, and myself. We are all very passionate about bringing awareness of the incredible things a child life program can do. So choosing a center that hosts families during a major event in their life was a chance to do this. Whether you have never heard of child life, are a little bit familiar, or maybe even pursuing it yourself, I am hoping this presentation shows you a little something or two that you did not know before. I also hope that you will be able to at least share with others the importance of having a program like this in hospice care centers. Okay, before jumping into how a hospice center can truly benefit from incorporating a child life program, I think it is important to start from the beginning for those of you that have never heard of this field before. So, let's take it back to where it started. Child life began to take shape in the early 1900s, when play was recognized as a fundamental part of a child's development. The early play programs consisted of leaders who trained hospital staff and volunteers how to communicate with children through play and gain a better understanding of the daily operations of the hospital and staff. Another important aspect in these play programs was preparing the child for upcoming procedures with role-playing. Research showed that using play to normalize the medical environment, educate children on medical procedures, and give the child some control in a new environment could help minimize the negative effects of the medical experience. Child life has continued to evolve and grow over the years, and today can be seen in many hospitals, not just in the United States, but around the world as well. As child life has grown over the years, so has the education and requirements to become certified. Currently, an advanced degree meeting 10 key areas of child development, an internship, and a certification exam must be completed, as well as continuing education to maintain your credentials. This is a rigorous process that ensures only the most qualified individuals are given the opportunity to handle the most sensitive of situations within the healthcare setting. Our goal today is to highlight the negative impact of not having a child life within hospice and show you what a difference just one child life specialist could make to the patients, the families, and the staff that were associated with the organization. I want to take a moment to highlight a key concept when it comes to children. Picture this. You are a child who has been newly admitted into the hospital. You have never been in an environment like this. You are laying in a bed with adults constantly hovering over you and talking in words that you do not understand. These words are making your caregiver cry, and you can feel the tension in the room. People in strange gowns are poking you and moving you, and all you can hear is a loud beeping noise. You keep talking and trying to ask questions, but it seems like nobody can hear you. How does this make you feel? Frightened? Confused? Anxious? Or like you have no control? Then imagine someone coming in and bringing in your favorite toy. Maybe it's a toy that you play with your siblings all of the time. It's familiar to you. You know what it is, and you know what to do. Play is the universal language for children. They recognize it, they control it, and they use it to make sense of the world. In an unfamiliar setting where they have no control and maybe even feel like their own voice is not being heard, this can make the difference. Any moment like this can be difficult or confusing for the patient or their family members. Child life is there to support, explain, educate, and bring play into the situation for everyone. Now let us bring the situation into a hospice center, where end-of-life arrangements are being planned and families are grieving. When a facility such as Hospice of Spokane does not have a dedicated child life specialist handling the individualized needs associated with the end-of-life care, this can put added stress and responsibility onto the other staff. For example, Nurses and doctors who are trying to meet the immediate medical needs of a patient may become distracted by a distraught parent or sibling and potentially lose focus of their primary task. Additionally, after death has occurred, the medical staff who is not specifically trained in handling the psychosocial needs of siblings and families may inadvertently cause increased suffering by not offering the recommended support. These scenarios are not helpful for anyone, not those affected by the death or the staff. Putting the staff in these uncomfortable situations where they do not have adequate training could increase undue suffering to all involved. Let us take a more in-depth look at the impact of not having a child life specialist within the facility, such as this one. Okay, let's first take a look at how this could have an impact on the child. Children are very complex and individualized. Each experience is going to be different within the context of hospice. Without a child life specialist there to assist in their care, it is likely that the current hospital staff is unable to meet the developmental needs of each child that is facing end-of-life care. Children's understanding of death and dying varies depending on their age. Hospice can be a frightening experience. Children often become withdrawn, but may be comforted by the presence of their loved ones. As the illness progresses, the caregivers become more focused on the child's physical needs. This makes the patient feel isolated and has a negative effect on their emotional well-being. Terminally ill children may feel a loss of control and have a sense of being different from their peers. Pediatric patients often express loneliness and do not discuss their feelings about death and dying with their nurse or their family. Children need a professional that can provide a play-based intervention to help the child express their fears and anxieties in an age-appropriate way. The consequences of not addressing the lack of psychosocial support through education for pediatric patients in hospice care is inadequate support and can be detrimental for a child. Now let's take a look at how this can impact our families. The ill child is not the only one affected when it comes to end-of-life care. Families are typically by the patient's side throughout the entire process, and they too have needs that cannot possibly be met by the medical staff at the hospital. The majority of challenges reported from hospice care environments come from the patient's caregivers. Families that utilize pediatric hospice care usually become the main caregivers for the child. In one study, they found that providing the majority of the care for the patient and making the difficult decisions increases stress and depression. Medical providers are not able to support families during these difficult times. Communication problems often arise between families and medical staff regarding major care goals, prognosis, and quality of care. In another study, parents expressed a desire to have providers on their care team that are able to discuss the child's diagnosis and prognosis in a way that could be understood by the parents. Parents and families have also expressed a need for help supporting their child's psychosocial needs. When a child is receiving hospice care, conflict often arises within the family. In addition to making difficult decisions regarding their child's medical care, families must manage regular responsibilities such as other children, work, and finances. In another study, 75% of families experience family conflict while their child is receiving end-of-life care. So how does this impact the staff? Without a child life specialist on staff at a hospice of Spokane, the nurses and social workers are often left to try and navigate the needs of both the child and the family, some of which may fall out of their scope. This can have a damaging impact over time. With the help of a specialist on board, we can avoid all of this together and allow these other professionals to focus on their one job and place all of their attention on the medical needs of the child. Nurses treating pediatric patients often report feeling unprepared to address children's questions regarding end of life. Caring for children that are dying is very stressful for nurses and physicians. Nursing schools average just 14 course hours on death and dying, and medical schools average 12 course hours. Studies have shown that less than 50% of medical residents receive training on how to discuss end-of-life care with families. In one study, medical professionals express a need for specialized psychosocial support for patients and families. medical staff reports that professional boundaries are blurred as to who is supposed to provide psychosocial care, and this affects the quality of care for patients and families. In that same study, some nurses reported feeling uncomfortable answering the patient's questions about death and dying. With these impacts, a child life specialist who is uniquely trained is needed. Child life specialists have extensive knowledge of child development and are able to communicate appropriately with children of all ages. They form supportive relationships with families and can educate families about their child's response to treatment, prognosis, and community services that may be helpful to them. The majority of the child life programs in the United States have an average of 33 course contact hours focused on death and dying. This suggests that child life programs focus much more on their training on being able to communicate and interact with patients and families. These skills make them a valuable resource to the medical team. Their specialized training gives them knowledge and skills to implement interventions that support children and their families in any setting. Child life professionals have a unique position in that their primary role is to provide psychosocial support to patients and families. With extensive knowledge of child development and medical care, child life specialists are able to present information in children in a way that is developmentally appropriate. Now, let's take it a little deeper and look at the many different benefits that child life has to offer. How can child life in a hospice setting benefit the child who is facing the end of life? One major role of a child life specialist is to listen to the patient's needs in a way that is non-threatening to the child, in a way that is developmentally appropriate. Children do not express their feelings or thoughts regarding death with their nurses, and they feel lonely often. A child life specialist can use their knowledge of child development and provide the child with the tools to talk about or play out their concerns. Oftentimes, medical staff will use the words such as stretcher or shot, which may scare the child and cause them to take these words literally. A child life specialist is also able to communicate to the children of all ages appropriately, which can provide the child with an exclamation that makes sense. Play is a universal language for children, and introducing this into an environment that is unfamiliar can help the child become more comfortable and willing to participate in their own treatment. Not only can a child life specialist be beneficial to the ill child, but they are also trained to help the families as well. A diagnosis can bring on a lot of difficult emotions, but without the support of hospice care or a member of the medical team that can assist to the needs of the family, it can make the experience seem impossible. In one study, it showed that providing a majority of the care for the patient without that extra support increased feelings of stress and depression. Hearing that a family member is diagnosed with a chronic condition can be difficult to digest. Not only are you having to process what this new diagnosis means, you are immediately given choices and information regarding which path you will take. With medical staff explaining these possible changes, the words or explanations they choose to use can be hard to understand. For this reason, parents have expressed a desire to have a provider on the care team who can explain the diagnosis and prognosis of the patient in a way that the parents can understand. In fact, not providing a staff member such as a child life specialist on the care team who can explain information and communicate with families and medical staff regarding the care of the patient has been a major reason for not choosing the facilities such as hospice care. Child life specialists create meaningful relationships with families and provide information they desire regarding the treatment plan or connecting them with community support groups can decrease feelings of isolation. Compared to nurses, child life specialists spend more course hours studying the topic of death and dying. This means that they are more prepared and comfortable to provide support during this difficult time. Not only can the addition of a child life specialist help meet the needs of the children and families, but it can also benefit the staff within the facility. Having a child life specialist as part of the hospice care team has the ability to create a more balanced atmosphere. No longer are the medical staff trying to fumble through the meeting, the emotional and psychosocial needs of the patients and their families. This aspect alone can greatly eliminate stress from the medical staff, which ultimately will be felt by all of those who encounter the staff. Having the assistance of a child life specialist will allow them to apply a greater focus to their primary responsibility of handling the medical care of the patient. Every death will be different. This means that the needs and the reactions of those involved will be different as well. There are times when the nurses simply need an extra hand. Even though a child life specialist has no medical background, in those situations they can be a huge help to the medical team by simply making themselves available. This could mean holding a tube, grabbing a medical tape, or using their specialized training to keep the child calm while the medical team performs a procedure. Once death has occurred, a child life specialist can be beneficial to the medical staff by facilitating grief and coping strategies with the family and friends that are present, giving the medical staff the needed time to wrap up the medical aspect of death, ensuring that the final details are carried out just as the family had wished. Child life specialists can also make themselves available to the staff after a death. This can be something as simple as a hand on a shoulder or getting them a hot beverage. Often in these situations, the staff has become detached and well bonded with the patients and their families. The child life specialist is able to put their skills to use within their own team, ensuring that all members are able to make a smooth transition and move on to the next patient with as little disruption as possible. So how does one go about adding a child life specialist to their team? So what does this actually look like? Child life specialists perform a 3-part assessment on how to help the child and their family based on child factors, family factors, and healthcare factors. The next 2 slides will show 2 examples of how a child life specialist could help a child and a family in hospice. Meet Samantha. Samantha was diagnosed with leukemia when she was 10 years old. She is now 11 and has gone through 2 rounds of chemo, and the cancer has come back. She is now facing the final days of her life as her body slowly shuts down. She is on a feeding tube and her hair has not grown back. Her family consists of mom and a younger sister who is 4 years old. Her grandparents also help to care for her, so her mom can keep working at her job. Samantha's younger sister is very scared of what is happening to Samantha and fears she will get sick too. She has been clinging to her mother and grandma more lately and refuses to sleep in her own bed at night. Samantha appears to be remaining positive about her situation, and her mom and grandparents are supportive of her being a part of her own end-of-life choices. A child life specialist could benefit Samantha and her family by helping to educate Samantha's sister, using developmentally appropriate language to explain what is happening to Samantha's body and why she is sick. The child life specialist could also help Samantha's sister learn that she is not going to get sick like Samantha from being around her, and that the illness is inside of her body, unlike a cold or the flu. Focusing on Samantha's end-of-life wishes and her bucket list could be helpful for the family to make more memories together with the time that Samantha has left. Offering community resources, such as pediatric cancer support groups for parents or caregivers and siblings, would be another way child life could serve this family. Meet Max. Max was diagnosed with Batten disease last year when he was 8 years old. Now he is 9 years old and has been battling this disease for the past 10 months. Batten disease is a genetic and it impacts the cells of the body and makes it so they do not get rid of waste. This waste builds up the body and causes rapid deterioration. Max is now blind, has seizures multiple times a day, is confined to a wheelchair, and is showing signs of dementia due to the disease. It is hard for him to eat and his health is rapidly declining. His family consists of mom and dad and his 12-year-old sister who was adopted. His parents have come to accept Max's terminal illness and have been supportive of trying experimental treatments and to make Max's end of life as comfortable as possible. Max's sister, on the other hand, is heartbroken about losing her brother. She understands Max's death will be permanent, but she says she will miss him too much. This family would benefit from child life services. A child life specialist would be able to focus on doing memory making while Max is still with the family to remind the family that he will be with them after he is dead. As well, the child life specialist would be able to encourage the family to use coping skills, like talking about their beliefs about death or after death, and to validate each other's emotions at this hard time. It is okay to be sad and mourn the loss, but it is also important to remember the positive and happy memories they shared with Max. The child life specialist could also help explain to Max's sister what is happening to Max and why he has the various medical equipment on him. Connecting to the community resources would be another way child life could benefit this family, such as a grief support group or meeting other families who have had a child with Batten disease. In conclusion, hospice centers such as Hospice of Spokane could really benefit from implementing a child life program into their service. Child life is there to support the psychosocial needs of both the patient and their family. Without specialists who are trained in child development and who have the skills to create a relationship with the patient through play, these centers may be failing to do everything they can to meet the needs of the family. Child life benefits the child, the family, and even the staff as they are there to improve service and promote normal development in a setting that is unfamiliar and frightening. With families agreeing that being informed of the diagnosis and prognosis and having open communication with the medical staff is a leading factor when choosing hospice care, end-of-life centers would stand out if they have incorporated a child life program. Thank you.